recording. Okay, welcome everyone. Thank you so much for tuning in today. Welcome to Changing Lanes Intervention Show with myself, Ashley Martin. To support, please share, like, and subscribe to our podcast on Brushsprout.com. Today we have a special guest by the name of Miss Brooke Terrell. Let's give her a warm welcome, guys. As she brings us awareness to the Autism Awareness Month. Our conversations and storytelling focus on destigmatizing mental health with honest discussions around mental health, counseling, applied behavior analysis, as well as any necessary lifestyles for overall mental well-being. A quick disclaimer here. By accessing this podcast, you acknowledge that CLI Human Services make no warranty, guarantee, or representation as the accuracy or sufficiency in this information featured on this podcast. This information, opinions, and recommendations presented on this podcast are for general information only, and any reliance on information provided in this podcast is done at your own risk. All right, so let's begin. As I mentioned, we have a special guest, Ms. Brooke Terrell, who's going to let you know a little bit more about her and her background. She's the CEO and founder of Therapy Works. She is a licensed and certified speech language pathologist. She's received her master's degree from Valdosta State in Georgia. She's also a native of Georgia. She's worked with both adults and children with various disabilities and differences for over 20 years. Congrats to that. Ms. Brooke, you're welcome. Ms. Brooke has combined years of quality speech therapy services, excellent managerial experiences, and an everlasting team spirit to facilitate some warm and growing environment of Therapy Works, which is now her name of a company, and they're celebrating their 10th year anniversary this year. Congratulations to that as well.
Thank you.
You're welcome. You're welcome. Lastly, she's a member of the American Speech Language and Hearing Association, as well as other local and national organizations. So welcome so much. Thank you. Thank you.
Glad to be
here. And we're happy to have you as well. Our topic today is the different language essentials for children to help coordinate with Autism Awareness Mission Month for children's developmental end milestones. All right, so we have a few questions for you, Ms. Brooke. If you can definitely share some light to these questions. The first question is, what are some different ways a child can learn how to communicate?
Oh, great question. There's many ways, that we learn to communicate. So, of course, spoken language is a given, but also, sign language, gestures, ASL. We also have AAC communication, which is alternative augmentative devices in case they don't have spoken language or can't use signs because of physical limitations. And of course, there's also visual support systems. So, we love vision boards as clinicians, which are especially helpful for children on the autism spectrum.
Okay. Well, thank you. Yes. We actually was going to ask about the AAC device and as well as sign language, especially for those that's non-verbal. Is that something that you definitely dealt with as well?
Absolutely. So, as therapists, we were always taught that sign language, it doesn't necessarily replace language, but it's a bridge to building language skills. So we introduce sign language to verbal and nonverbal kids early on. Even with my own kid, she knew how to do more before she could speak, because it just gestures with language, and in turn it helps build those language skills, and it teaches them how to basically understand language and body gestures, and which is so important for social skills. So definitely we incorporate sign language in everything.
Well, good. Well, thank you for that tidbit on that. Now, what age range should you say your child should be able to engage in that back and forth conversation?
I have always, my go-to is 2 years old. You should be able to have a back and forth conversation with a 2-year-old. Now, of course, it's limited limited and every child is different. Sometimes you may see it as early as 18 months, but they should be using short phrases and be able to ask and answer questions by 2.
Okay, good, good. So you definitely hear that, parents, by 2 years old. What would you say the
Mm-hmm.
difference is between nonverbal and non-vocal?
So nonverbal, of course, is basically meaning without words, whether it's spoken or written words. Vocal, of course, is basically speaking to the sounds that we can produce from our vocal cords and so forth. So to be non-vocal is basically you're not able to make sound.
Right.
But to be nonverbal, it's just you don't have the spoken words, but it's not necessarily meaning you can't
Not making any
communicate.
sound. Yes, I think that's the
Mm-hmm.
important thing to recognize the differences, because there are some situations where children are making sounds, but they're not necessarily verbal as far as that word, that communication, that articulation, being understood exactly what they're actually saying as well. So
Exactly.
I think that's definitely important. Um
Mm-hmm. And
last
just
few
to pick,
mhm.
I'm sorry, just to pick, so, and also with the autism community, there's a movement where they're moving more towards non-speaking versus nonverbal. And
Okay.
I think, yeah, you know, we're getting more politically correct with language and terms now, but non-speaking basically saying that, you know, just because I'm nonverbal doesn't mean I cannot speak and communicate. So you'll see that a lot as well.
Yes, definitely so.
Mhm.
All right. And what age range would you say your child should be able to like grasp that those fine motor skills?
So now we're getting a little into occupational therapy. By trade, I'm a speech therapist, but because I've worked with
Mm-hmm.
occupational therapists and physical therapists for so long, I've learned a lot.
Mm-hmm.
But basically, I believe right around 1 years old,
One. Okay.
they really should be playing with finger food. Now, of course, the grasp might be like a whole fist grasp at first, and then eventually, as they get older, it'll go into a pincer grasp, you know, with the thumb and the forefinger. But anywhere from actually 6 months to 1 year, they should be getting to those self-feeding skills and able to hold utensils and, you know, at least the sippy cups.
Yes, yes. Okay,
Yeah.
well, thank you. Remember, this at least by 6 months, 6 months on up.
So introduce that at an early age, you know, just give them the Cheerios, you know, give them the puffs, you know, put it on their trays and just let them go for it.
Yeah. And our last question, what signs would a child exhibit or show that they're needing physical therapy?
Okay, so well, physical therapy, you know, we're thinking of gross motor skills, you know, the running,
Mm-hmm.
the jumping. So if a child, one, of course, is not sitting up, you know, at a certain age as their match peers who are sitting up at that age, or being able to hold their head up, they may have low muscle tone. You know, that's a warning that you might want to refer to your pediatrician. um, there are milestone charts that parents can go by
Mm-hmm.
all over the internet. You can actually go to ASHA.org and they'll have developmental milestone charts for you for communication and physical skills and motor
Okay.
skills. However, typically, you know, physical therapy can also be warranted simply because of, you know, orthopedic issues, the fractures, the broken
Yeah.
legs, but and of course neurological issues too. Typically, children with cerebral palsy or spina bifida is going to need physical
Mm-hmm.
therapy, you know, probably most of their lives. But yeah, anything where you feel like there's muscle weakness or they're not able to complete those activities of daily living, which is
Okay.
the dressing yourself, brushing your teeth. If you're not seeing that at the same time that their peers are being able to do those things, you might want to
Indication.
refer your child to the pediatrician. Mm-hmm.
Okay. Well, good, good. So please tell our viewers how they can start the process or application process when it comes to your services?
Absolutely. So yeah, again, we are celebrating our 10th anniversary. I can't
Yes.
believe Therapy Works has been in existence since 2014. My goodness. And we are a totally virtual therapy clinic for pediatrics. So we were, in the physical space, but of course, 2020 took over and we were half and half. But we still had a lot of families who, appreciated the advantages of staying home, not having to worry about the travel or transportation issues. And the beautiful thing about teletherapy is it requires and allows parents to be actively involved in their therapy sessions with their
Yes.
children. And so they can simply get started on our website, therapyworksclinic.com. We have a getting started page, and everything is there step by step to get registered and get started. We have a great office manager who's our client and clinician coordinator, Miss Teresa, who is going to greet you
Yes.
with a smile. And she's going to help you along the way and answer any questions for getting started. But everything is at your fingertips.
Okay, and don't forget, therapyworksclinic.com is the website.
Yep.
All right.
Therapyworksclinic.com.
Mhm. So if you like to seek any professional help for any developmental milestones and or mental health, feel free to reach out to Therapy Work and or Changing Lanes Intervention Human Services. My name, once again, is Ashley Martin. I'm a licensed psychotherapist, also licensed and board certified behavior analyst. I've also got certifications when it comes to substance abuse and anger management as well. Feel free to reach out to us on a weekly basis. We offer autism and parent support training and consulting services. Our address is 500 West Lanier, Suite 608, Fayetteville, Georgia 30214. And our website is clihumanservices.com. And once again, thanks for coming and joining on our show. We definitely appreciate you so much, Ms. Terrell. And don't forget to like, share, and subscribe to clishow.buzzsprout.com. All right. Thank you so much and stay tuned.
All right. Thank you, Ashley.
All
Thank
right.
you for bringing awareness.
You're
Yes.
welcome. You're welcome. Have a good one.
You
Bye.
too.
Bye.